You're asleep. Everything feels normal, quiet, still, and then suddenly, something feels off. There's a heavy weight on your chest, your breathing turns shallow, your neck stiffens and won't move. You try to shift your body, but nothing responds. It feels like you're trapped inside your own skin. And the scariest part? You don't even realize what's really happening, because this isn't just a bad dream. This isn't random. It could be your sleeping position, slowly reducing oxygen to your brain, night after night, pushing you closer to a stroke without you ever noticing. If you're watching this right now, I want you to do something simple. Type the number 1 in the comments. That tells me you're here, you're aware, and you're taking your health seriously. Now let me introduce myself. I'm a geriatric doctor. I've spent over 25 years working with adults over the age of 50. And I want to be honest with you. Some of the most preventable hospital cases I've seen had nothing to do with major illness and nothing to do with accidents. They came down to something people do every single night, the way they sleep. I know that sounds hard to believe, but stay with me. Over 70% of adults over 50 struggle with sleep issues. That includes poor sleep quality, frequent waking, and something called sleep apnea. Now here's the part most people don't realize. If you have sleep apnea or consistently poor sleep, your risk of stroke can increase by 2 to 4 times. That's not a small number. That's life-changing. So why does this happen? It comes down to oxygen. When you sleep in the wrong position, your airway can become partially blocked. Your breathing becomes less efficient. Oxygen levels drop. Your brain depends on a steady flow of oxygen to function properly. When that flow is reduced, even slightly, your heart has to work harder to compensate. And over time, night after night, year after year, those small drops in oxygen begin to add up. They don't cause damage all at once. They build quietly, silently, until one day, your body can't compensate anymore. That's when serious events like strokes can happen. And here's the truth most people don't want to hear. This risk is often preventable. That's why in this video, I'm going to walk you through 4 sleeping positions. We'll go from the least effective to the most beneficial. These are simple changes. No medication, no expensive equipment, just smarter positioning that helps your body work the way it's supposed to. Let's start with number 4, side sleeping. Now this might surprise you. Side sleeping is actually very common. In fact, many people believe it's the healthiest way to sleep. And it can be, but only if you do it correctly. Here's where most people go wrong. They lie on their side without any support. Their top leg falls forward. Their hips rotate. Their spine twists slightly out of alignment. It may not feel like much in the moment, but over the course of 6 to 8 hours, that misalignment puts constant strain on your lower back and hips. I once worked with a 62-year-old woman who came to me with chronic hip pain. Every morning she woke up stiff, sore, and uncomfortable. She assumed it was just part of getting older. But when I asked about her sleeping habits, I noticed something. She slept on her side, with no support at all. So I made one small recommendation. I told her to place a soft pillow between her knees before going to sleep. That's it. Nothing complicated. 2 weeks later, she came back and said her pain had improved by about 70%. That's the power of alignment. That pillow keeps your hips level. It prevents your spine from twisting. It allows your muscles to relax instead of staying under tension all night. And there's another benefit. If you sleep on your left side, it can help improve circulation and reduce pressure on certain organs. It can also help keep your airway more open compared to lying flat on your back, which means better oxygen flow to your brain. Now, if this is already making you think differently about how you sleep, type the word help in the comments. Let me know you're still with me. Let's move on to number 3, sleeping on your back. Now, back sleeping can be very comfortable, but again, it depends on how you do it. If you lie flat on your back with no support, you're putting a lot of pressure on your lower spine. Over time, that can lead to stiffness, discomfort, and even chronic pain. But here's the adjustment that makes all the difference. Place a pillow under your knees. This small change helps maintain the natural curve of your lower back. It reduces strain and allows your spine to rest in a neutral position. Now let's take it one step further. If you slightly elevate your upper body, around 30 degrees, you create even more benefits. This helps prevent acid reflux. It keeps stomach acid from traveling back up into your esophagus. But more importantly, it helps keep your airway open. Because when you lie completely flat, your tongue and soft tissues can fall backward, partially blocking your airway. That's one of the main causes of snoring and sleep apnea. I had a patient, 68 years old, who struggled with chronic back pain for years. He tried everything: medication, therapy, stretching routines. Nothing gave him lasting relief. Then we adjusted his sleep position. We added a pillow under his knees and slightly raised his upper body. Within 10 days, his pain was almost completely gone. No new medication, no complicated treatment, just better positioning. Now let's talk about number 2. What I like to call the starfish position. It sounds a little funny, but it's incredibly effective. You lie on your back, your arms are relaxed and slightly spread out, your chest is open. Your shoulders are not hunched forward. This position helps release tension throughout your upper body. It opens up your chest, allowing your lungs to fully expand. That means deeper breaths and better oxygen intake. I once treated a patient who complained about waking up every night with numbness in her hands. She thought it was a circulation issue, but after evaluating her posture, it became clear that she was compressing nerves in her shoulders and arms while she slept. We switched her to this open position. Within days, the numbness almost completely disappeared. When your body is open and relaxed, your breathing improves. Your heart rate stabilizes. Your blood pressure can even decrease. And all of these factors play a role in reducing your risk of serious conditions like stroke. Now we come to number 1, the most effective position overall, the 45-degree position. This is what I consider the sweet spot between side sleeping and back sleeping. You're not completely on your side, and you're not flat on your back. You're somewhere in between. About a 45-degree angle, you support your back with a pillow so you don't roll over. You place another pillow between your knees, and you make sure your neck is properly supported so your head stays aligned with your spine. This position checks all the boxes. Your airway stays open, your spine remains aligned. Pressure is evenly distributed across your body, and perhaps most importantly, your brain gets the oxygen it needs to perform its nightly recovery processes. There's something many people don't realize. While you sleep, your brain is actually cleaning itself. It removes waste products that build up during the day. This process depends heavily on proper blood flow and oxygen levels. If your breathing is restricted, that process becomes less efficient. I once worked with a 72-year-old man who had already experienced a mild stroke. He was recovering, but still at risk. We made several lifestyle adjustments, but one of the most important changes was his sleep position. We transitioned him to a supported 45-degree posture. Over the next 2 years, he remained stable with no additional complications. That's not luck. That's giving the body the conditions it needs to heal and protect itself. Now, before we finish, I want to quickly go over a few positions you should avoid. Sleeping on your stomach is one of the worst. It forces your neck into a twisted position for hours at a time. It can restrict blood flow and strain your spine. Curling up too tightly is another issue. When you pull your knees all the way to your chest, you compress your lungs. That limits how much oxygen you can take in with each breath. And lying flat on your back with no support can allow your airway to collapse more easily. Finally, sleeping in a chair may seem harmless especially if you doze off while watching TV. But over time, it can increase your risk of poor circulation and even blood clots. So here's what I want you to remember. 3 simple principles. Keep your spine aligned, keep your airway open, and use the right support. These are small adjustments, but they can make a massive difference in your long-term health. Never underestimate something as simple as how you sleep, because it can influence how your brain functions, how your heart works, and how your body recovers. And in some cases, it can be the difference between waking up healthy tomorrow or not waking up at all. If you made it this far, I want you to type, "I'm ready" in the comments. That tells me you're not just watching, you're taking action. And one more thing. Share this video with someone you care about, a parent, a spouse, a friend, because the information you learned today could save a life, maybe even theirs.